Today, we're helping you unlock your brain's full potential through brain-based whole wellness, a new health trend to help you improve cognitive, emotional, and physical health by training your nervous system. Bloom Health Club starts now.
From the Stream Center, welcome to Bloom Health Club, sponsored by Monticciolo Family and Sedation Dentistry.
I'm your host, Gayle Guyardo, and our guest today is Dr. Hector Rodriguez, a psychiatrist specializing in trauma, brain health, and emotional intelligence. He integrates neuroscience, lifestyle medicine, and practical strategies to help people rewire their brains for resilience, focus, and well-being. Dr. Hector, it is such an honor to have you as the newest member of Bloom Health Club.
Thank you. This is awesome.
I had the incredible opportunity to meet you through a man who many consider to be the world's most famous psychiatrist, Dr. Daniel Amen. And you worked together for many, many years, and now you're off doing a new venture called the White Butterfly Clinic. Tell me about it.
Yeah, so the White Butterfly came out of the idea of the word psychiatry means the medical treatment of the soul. And that's what White Butterfly stands for. And I really started working on this because I felt that this is where future of mental health is headed. I'm a firm believer of whole wellness, which is taking care of the entire human being. And the soul is one of them. I don't know if you knew, but I have a master's in theology. So for me, spirituality is a very important part. And I think in mental health, we spend a little bit of time tapping into that, but not enough. So that's what I try to do at the White Butterfly.
I think that's so cool because actually until now and talking to you with all the coverage I've done over the years on mental health, I never realized that at the core of it, you actually are practicing on healing the soul. And I think so many of us are walking around with broken souls, at least at some point in our lives.
I think we have a lot of wounds. And it always hits the soul. And I always tell my patients, I don't want to sound corny, but it's true, right? We do have a soul. We do have this being, and it's our person. And a lot of the times we see symptoms of anxiety, depression, social anxiety, for example, is one of the big ones. And a lot of that comes from your soul that has been hurt at some point. So I work with things like confidence, and if I can teach you confidence, because that's something that you can actually learn. Right? That's what we talk about, rewiring our nervous system. Let's teach you that. So then when you are in that social situation, you're not going to freak out. You're not going to have an anxiety attack.
And something that I learned along the way, because I always share this with our viewers and our listeners, is when I have the privilege of having somebody like Dr. Hector Rodriguez show up, I really want to soak in what they're saying and try to live it in my own life. And so because of you and Dr. Amen, I decided to try brain mapping. And I'll be transparent. I really did it just for the story and to show the viewers of how it was done. And then the woman that did it for me, she looked at me and she says, "You have a lot of unresolved trauma, Gayle." And I was like, I'm good. I'm thinking to myself, I'm living my best life right now. And she goes, "I don't care what you think. The mapping shows something different." And I think so many of us as adults white knuckle our way through. We think that we've figured it out, but there are things in our past that are holding us back because we refuse to look back in that direction. And then once I went through EMDR and got the treatment for it, it was a game changer. So you do this for people. You help them resolve traumas that they might not even realize exist.
Yeah, that's. I'm glad she did that, and sometimes I think clinicians are afraid to tell patients that kind of stuff, like, "Hey, I see this in your brain scan or in your brain mapping," and for me, it's like if I see that, I have to tell you, because I know the trajectory of your life, how it can totally change. And even though you might feel in that moment, you know what, I'm doing good. I don't have any major problems or anything that I think I have to deal with. But you never know when you're going to have a stressor that I tell my patients smells like, looks like, sounds like that other one that is in your subconscious. Because then symptoms can really explode out of nowhere. And I do see a lot of people that's what happens to them. right? They'll get to a certain age or a certain place in their job, like status, and then suddenly they can't sleep. Suddenly they can't focus. And they're like, wait, I've never had these problems before. So then when we map them, we scan them, we see trauma patterns, and we're like, most likely this thing got tapped into again.
Interesting.
And it was related to that other stressor that maybe right now they don't look the same, but your brain remembers it as the same feeling. Hey, I don't like this feeling. And then you have all these symptoms that come out and people don't know what the connection could be. And a lot of the times it's an old trauma pattern.
It's so interesting. But this is not all that you do. I love the fact, now I know you treat men and women alike, but a lot of your practice is women that come to you for help. And in addition to using the latest and the greatest when it helps to healing these old patterns, you look at people and their entire body as a whole. And that means running some tests and understanding what's really going on with them, which I think is so brilliant, because I think we've all fallen into this system where we go tell our doctor what's wrong, they write us a prescription, I hope that helps, and off you go. But that's not how you handle treating your patients. Even when it comes to their mental health, it could be caused by what's going on with their physical health.
Yes. I first try to see the entire picture. And sometimes my patients are like, this is so many questions that you're asking me. I'm like, well, I need to look at the whole thing. So paying attention to your hormone system, your immune system. One of the things I try to educate all my patients, you got to remember that there's a reason why we call the brain the computer. It's controlling everybody else. And sometimes you might have a rash or really bad GI symptoms, and no one made the connection that is high levels of stress or trauma that you've never resolved. So when someone comes to me, I ask them all possible questions because I want to know what's going on with their immune system and with their endocrine system, which basically are hormones. So I have to look for those. And then I order a really intensive lab panel. I had someone call me one time a vampire. They're like, I got so many vials taken out for you. I'm like, I have to, because I can see other things that are going on that are leading to this depression, that are leading to these symptoms of anxiety or stress and burnout. And other systems are going to start letting us know.
And the problem is, and again, I am not trying to poo-poo our healthcare system, but it is what it is. And doctors only look at so much of your blood work, or they work within parameters. When you do these deep dives into blood work or, anything, however you're testing and all the questionnaires, it gives a much bigger picture of what's going on. So it's easier for you to help someone and they'll see results faster.
They do. And I always tell them, listen, I'm not an everythingist. I don't specialize in everything. So if I notice that there's something that come back abnormal that is out of my scope, then we got to bring in that expert. But big, important thing that I tell them, that expert has to be willing to collaborate with me, like true collaboration. So when I work on building this team for the patient, me and my team in the office, that's literally what we're doing all the time. We're looking for providers who are willing to sit down 10, 15 minutes whenever possible so we all discuss the patient, even if they don't work in their clinic. So that's one of the things that I actually learned from being a fashion photographer. I remember when we would put together photo shoots, I had to get the makeup artist, the stylist, the art director, everybody, and we would meet multiple times leading up to the photo shoot. I have to take that practice into medicine. And unfortunately, we don't see that much of that today. And I'm really hoping to change that, because we have to. I think our people, like all of us, we need that kind of care. And I think one of the things I try to motivate my colleagues is to be thinking more as a true collaborator, because let's face it, I can make your problem and you're working with a patient easier, and you can help me just by us collaborating for 5 or 10 minutes every once in a while. And I see it all the time when I work with therapists and other providers in other countries where we're all working together, like, oh, okay, now I see it. And we tell each other that, oh, now I get why you're working on that. And the patient just gets better much faster.
I love that. I love that. And I do want to circle it back to bring a little clarity. Dr. Hector started his life off as a fashion photographer, and he was always working with women, and he decided that he should go to school for this. And he went to school for many, many years to become an OBGYN. And through an elective, he realized that he has a passion for our brain health and for, helping women and men alike, but especially women. And I think that's so beautiful because we have fallen by the wayside with flawed studies that are directed towards men, and we don't get the treatment that, quite frankly, we deserve. We don't get the deep dives. And there could be women out there with their hormones unbalanced and they're depressed and not realizing that that's the reason why. And then a doctor gives them medication for, an antipsychotic or antidepressant, and they don't need that. All they need is to have their hormones balanced.
Correct. And I see that a lot today, and it's scary. And I say it's scary because I'm sure there's a lot of women out there who are not properly treated, or they think, hey, this is the best I'm going to get. And once you start seeing these other potential causes, it's really liberating when you see the person comes back a few weeks later. They're like, oh my gosh, I feel so much better now. I didn't have to take that thing, or I didn't have to do that treatment. It wasn't for me, But again, it goes down to us being able to collaborate as providers so we can communicate. I mean, when we look at women's health today, and I'm so excited to be alive during this time because there's more focus on that. And I think it needs to be. There's definitely different kinds of even brains between males and females. And that goes to show that we need to be looking at the medicines a little bit different when we're studying the two individuals.
I want to also talk about the soul of all of this, because I think that that's really, really fascinating. And I don't make it any secret on the show or here on Bloom Health Club that I am a very spiritual person. It is something that I rely on every day of my life, and it's what gets me through my hardest parts of life. And talk to me about how you help people at the level of their soul.
It's funny, I've been asked that a lot lately, and my answer is always the same. I can't not have it. One of the first things I have my patients do is I want you to write a description of who you are. Not what you do, not what you've known for or you've been known for, but who are you? And we start diving into who you are as an individual, who you are as a person, what do you add to society, being who you are. So when I start working with someone, that's where I start. I start at trying to understand their soul. And if I start seeing things that, I think that might be where that trauma is coming from, right? Because they'll start sharing things with you. And it just happens. I mean, it's one of those things. Then I can start focusing on, okay, well, this is an area that needs healing. Because now you're telling me something about who you are, or at least how you perceive yourself, that there's a wound in there, right? So I spend a lot of time on the spiritual side. And there's some people that believe that doctors shouldn't be doing that. I totally disagree. I think if we don't, who will?
Right.
If someone is coming to me because they're having some kind of physical symptom or mental health care symptom, but I notice that, I can't ignore it. I can't. So if they're not going to go to their support system, whether it's someone at church or wherever they practice their beliefs, then I need to do it. Or at least I feel that I have to. And I tell my patients, listen, if I feel that there's something here that I should not be working with you, I'm going to tell you where to go. But if we don't start it, I mean, most people, when they're dealing with something, even as thoughts of suicide, for example, they're letting us know. They're just letting us know in a way, sometimes not so directly. So you need to be very sensitive and aware of how they're expressing themselves. And when I see that, I have to dive in.
I love it. I love it. Talk to me more about how you teach people to have confidence, because I think that is such an important skill, and I didn't realize that it was something that you could learn. I just thought it was something you had to be born with.
No, you learn it. One of the first things I tell patients to do is that, right? Tell me who you are. And if I pick up certain descriptions that I'm like, okay, we're dealing with a confidence issue, I start with, let's look at the small things in your day that bring you joy or that give you what I call the little dopamine pop, right? Mm-hmm. That we start feeling good about ourselves. And it could be as simple as I picked up my room and I got myself ready to go out of bed. Okay, let's stop and look at that. You accomplished something. No, that's not a big deal. No, it is a big deal. Some people can't. Some people can't physically get out of bed. So award yourself that. I think we're living in such a high pace, dopamine-driven times that we're not stopping to look at those moments where you've accomplished major things. again, we only think that the major things are huge, life-changing. I saved, all these people. Sure, those are great things. But anyone that works with the masses like that can tell you that that's not what fuels them. What fuels them is those little moments of confidence throughout their day. And then having moments of gratitude. I think gratitude is a practice that is not focused on too much. And I think the reason why is because a lot of us are hurting from old traumas that we haven't been addressed, like being ignored by someone, and we start having this like just kind of hatred a little bit towards people, that we fail to practice gratitude. Because I might have a difference of opinion. We talked a little bit about this earlier. I might have a difference of opinion with you about something, but I still, enjoy you as an individual. I still want you in my life. I'm thankful for you being in my life. If we disagree on something, that's okay. Yeah. I can't be bitter at you. You have your own opinion.
Right.
So teaching my patients to have those moments of gratitude, even with people that you don't agree with, that you don't see eye to eye, but they're in your life. Enjoy the moment, and also enjoy that they're challenging you, because challenging is not necessarily a bad thing. I think we're trying to teach people to live in a bubble with no pain, with no issues, with no stressors. That's not the real world. The real world, we have constant stressors. And my job is to teach you those small techniques so you can build confidence, to then build the big one, which I care about, is resilience.
I love that. I love that. Talk to me about the White Butterfly magazine. What kind of messaging are you trying to get out to the masses? Because I realize that maybe not everybody can come in and get the opportunity to see you as a patient, but you're still trying to find other avenues to educate folks.
So every issue is a certain quality. And I actually learned that from my beliefs in the Bible, right? I looked up things that I think are valuable, like confidence, integrity, connection. Our next issue that I'm working on is the connection issue. So these are things that I think add depth to our soul, and we don't get so stuck on symptoms. And what I mean by that is, I think in mental health, we're so focused on symptoms that we miss the boat on giving people the tools to build their confidence, to have resilience. And that's what the magazine is all about. It's different stories. There's a section about letters to yourself. So I have some of my clients write letters to their future self or their past self to enhance these qualities.
I love it. I love it. Okay, what we're going to do now is we're going to answer a fewer questions, and our director behind the scenes, Nacha Castilla, is also switching everything. But if you want to jump in, my friend, with a question, please feel free. But we'll start with the first one Chris. Chris wants to know, what are some signs that our brain health might be affecting the way we interact with others, maybe without us even realizing it?
That's a that's a loaded question. So when we start seeing that we have this quick, snappy way of responding to people, for example, that's already giving me a red flag of there's something going on. We have our brain called our temporal lobes that regulates our emotions. So sometimes if we've had continuous hurt by someone, then we're more likely to kind of train our brain to be snappy or to be defensive. Mm-hmm. So that could be a really quick sign to say, okay, I got to work on how I interact with others.
Okay. The next question comes from Justine. How do you define emotional intelligence, and why is it so critical for both personal and professional relationships? Which is a great question, because Dr. Hector wrote an entire book about this.
Yeah, so emotional intelligence, in a nutshell, is being able to have that, I call it that sensitivity for others' feelings and emotions, and also with yourself. Once you have that, that's what we can have better ways of interacting with other people. Because if I can just notice that maybe right now, by the way you're positioning your face or your body, there's something going on, I'm going to be more sensitive to how I respond to you, for example. And that's having good emotional intelligence, to know, hey, something might be going on with her. Let me not go there today. Or, you know what, why don't we take some time to talk? You need to have that ability. I think it enhances our relationships, both in the professional world, but also in our personal world. And that's where I focus on the most, is how do we take that into our personal life and make it part of our identity? Like I can sense there's something going on with you, and I need to spend some time talking to you.
So you actually teach people through your book and through other avenues that you get information out there is how to tap into our emotional intelligence. Interesting. Okay. Let's go to Michelle. Michelle wants to know, is there a point where it's too late to change how your brain works, or is it really a lifelong process?
So it's never too late. And that I learned from Dr. Amen. I have to quote him on that one. It's never too late to change your brain. It's never too late. And first of all, understanding that everything our environment is perceived through our brain and our brain functions, that we can change it at any time. There's things that we can do to prevent the breakdown of our brain functions. And then there's things that we can do to enhance our brain functions. And that combination is what gets us to a younger, healthier brain. So then we can have better interactions, better, even self-love. If we don't have a good, healthy brain, it's going to be really hard for us to do any self-love and self-healing.
Now, I know that, and it's what I love about you and Dr. Amen is that you don't look at brain health just through medication alone. It's, lifestyle changes, not drinking, not leaning on maybe medical marijuana or anything else for that matter. But you also look at things on a whole level of our relationships and community and all different layers of brain health that I don't think a lot of people associate that's so important to support it.
We are social creatures. We love groups. And I think when someone is struggling to be in a certain environment or a group, they're misaligned with who we are. So to me, building relationships is priority. It's the people that we surround ourselves with. There's a Hispanic saying my mom always says, and it's like, tell me who you are and tell me who you're with. Kind of like that. Is that how you translate it in English? And it's so true. We are a lot of who we surround ourselves with. So that means relationships. So if we have good, healthy relationships with those around us, but then also with ourselves, we're golden.
I love that. I love that. So, Dr. Hector, how do folks find you now? Like, how do we connect?
Well, in social media, I think everyone social media these days. And my Instagram is Dr._Hector. And then I have my website, which is drhector.com. And then the clinic is the whitebutterflyclinic.com. I love it.
And the magazine, how is that distributed?
We have some physical copies that some people sometimes really enjoy, and I personally enjoy them. But we also have them for free in the White Butterfly Clinic.
Oh, you
can
do?
click on magazine. Yeah.
Oh, great.
They're all in there.
So people can kind of access your knowledge and learn. And you say every issue kind of revolves around one subject.
And then we also have the Power Up series, which that one is more like a workbook, working on all these different areas.
I love it. Well, Dr. Hector, it is such an honor and a privilege to have you appear on our globally syndicated show, Bloom, but now to have you as our newest member of the Bloom Health Club.
Thank you. It's fun.
All right. And listen, I need to give a special shout out to Monticciolo Family and Sedation Dentistry, which truly believes in our mission to get this kind of information out. And without them, we wouldn't be able to bring this messaging to you. So thanks again to Monticciolo. And you can watch our streaming show, Bloom Health Club, on Apple TV, Fire TV, Roku, Samsung TV, WFLA.com, and YouTube, Spotify, and Apple Podcast. And I will see you on the next Bloom Health Club.